Good afternoon, everyone. This is Richard Smith. I'm a senior Dynamics solution architect with AKA. When looking at this, what we've heard from Fairfax and from many other organizations is they may have a state or local website where they're providing information very similar to this. So we're using the Power Apps portal to provide this information. If they do not have a page and they want to stand something up quickly, the portal is a great way of putting that in. We actually brought in the COVID-19 tracker from Bing and some other information, but this is just sample information that they could possibly provide. Each organization is probably going to bring up stuff that's specific to their locale, to their city, state, whatever they would want to have. What we have seen in many cases is this next piece, the complete the new exposure survey, where they're going to want to go and take this and bring this to the next step. So, forgive me, I put this in the full screen. And if we click on that link, it brings up an exposure survey. We don't want to require too many details. We definitely need a name. We probably need one means of contact to get back in touch with them. But we're looking for who they are, where are they physically. Then we're going to start asking some questions. And this is modeled off of websites that we found for a number of different locales. But have you traveled outside of the United States? Where? Do you have any basic symptoms? Do you have any pre-existing conditions? Are you pregnant over 65 or other particular issues? Have you been tested and what were the results? And do you know that you have any thoughts that you've been exposed to others or that there are others that may have, do you know who may have exposed you if you did come back positive? Simple profile to help them provide information to us. Now, what is the use case for this? In some cases, locales are putting something like this up. So if someone is concerned, they can contact their local health department, provide this information, and essentially request a callback or a triage from the health department. We've also heard some scenarios where, as people are doing some of these drive-by tests, like where there's been a experimental testing facility set up to administer the tests, as they're driving through, they need some way of gathering contact information and going through a similar exposure summary. So this doesn't necessarily only have to be used by the off of a website. It could be used, for example, off of someone's phone as they're trying to fill this in, and we'll actually show the mobile client in a little bit. Once this is submitted, we come into Power Apps. We built this, we use the full Dynamics 365, but this could really just live in terms of a Power App. We have a dashboard of our exposures that is pre-filtered. So I'm focused in Massachusetts. So I'm going to take a look at the ones that I have in Massachusetts, and I could see some demographics around multiple conditions or hypertension for our pre-existing conditions, a couple of different outcomes of getting tested, and 3 have actually gone to the hospital. 2 did not travel outside of the country. 2 traveled within the last 3 weeks. So these might be ones I'm interested in. I can go into a particular person's exposure survey, and this will be exactly what they have provided to us online. We've added a couple of extra fields because if somebody's driving through, they might be coming through with a sick parent or a sick child, or they might be the spouse. So it may not be the actual person giving us that information. It might be someone else. And usually we've heard from the health departments, it's important to track that because they may want to make sure that they've got that person's contact info in case they were exposed or we need to get back in touch with them. We have the same exposure details that will help us do some of this triage internally. We can go and associate this with other contacts, and then it would associate this exposure survey and then prompt us to do follow-up. So we'll talk a bit about follow-up in just a second. But if I want to go and track that Sarah's called us and I know that her husband, Simon, was also potentially exposed and we want to reach out to him, we can add him in and have a process that goes and generates a call plan, creates a new exposure survey for Simon that we can go and follow up on. Ultimately, this is, until we get here, this is really what we've seen on that health survey. The follow-up is the most important piece of this, and this is where the real activity is coming, and we're seeing from a call center perspective, this is the interaction facility that we're having with that contact. So what is their status? It'll come in originally as submitted. It may be incomplete, so we need to do a couple of phone calls out to the person to try and fill in the ultimate status, find out, have they had any fevers? Have they not? Do they actually have pre-existing conditions? If we're working with them, this will be in a triage matter, and we can start to track specific statuses of where we are. We weren't able to make any contact. We've not been able to get a hold of them. We've tried unsuccessfully. Or in this case, we had an unsuccessful first phone call. We sent them an email. We had a successful second phone call, and they said yes, they met the criteria that would say maybe they're over 65, they have one or two pre-existing conditions, and we think that there's a good likelihood they're exposed. We might want to go ahead and recommend that they go get tested. That brings us to the recommendation side of this, where we can have a Power BI map that's showing and plotting out the testing locations that are nearest to them, and we can recommend one. So in this case, based on Sarah's location, we recommended that she goes to Mass General Hospital, and we know that they have a testing plan. We have called out to them and set up a testing date and time. And then using email templates, we can reach back out to her. We can provide this information over the phone, but we can also reach out to her and say, here's your appointment date and time. Please print this out, have a copy of this. This will let them know that we did set this up for you and you can go in. Now, this is not going to necessarily be the same for every locale. They may have a form. We might want to PDF something. We might want to print out a document or email them a document. We might even be able to drive them back to the Power Apps portal and have them print something out there. There are a number of different ways that we can handle this. I think the important part of the story is that this functionality exists, and whether it's an email or a document or something they're downloading from the website, we can provide that to them. And the final piece of this from the Power App component is the reporting aspect of it. So we've put together some Power BI reports to show, in one case, kind of the overall summary. So I can look at, if I'm maybe at a state level or at a county level, I'm looking at all the various districts in my county. I can see, the total cases, what the status of everyone is, and start to drill through. And as I drill through, so I've now narrowed this down to the state of Massachusetts. I'm seeing where my hotspots are based on the map, and I can zoom into that, and I can also narrow down into specific places. So if I want to see, sort by location, I want to see just the people, because I may have preloaded this. I can start to filter in on these, and actually, if I right-clicked on one of these, I can drill in and see the details for a very specific patient based on what I have. Now, I'm not going to have their full EMR or medical record here, but I might have, the information they had from the survey, so that I can see this, and when I'm calling into the testing facility to tell them what I know, to reiterate this information, possibly even send some kind of a secure message or enable the hospital or hospital contacts to reach out to our portal, log in, and gather information upon this, if that makes sense. So basically just showing, when we develop this, one of the benefits of the Power App platform, both portal and application, is that this has responsive design. It's going to fit and render itself very nicely on a phone. These were screenshots taken from my iPhone. So you can see, you kind of have the exact same information on the home page. You can scroll up and down. You can go and complete that new exposure survey, and it's going to look exactly the same, being able to provide your contact information, gender, the exposure summary. There's a CAPTCHA on the end, so we're not getting a whole load of crazy submissions, automated submissions. Once that's submitted on the inside, so this might be a constituent who is requesting it. On the inside of this, we still have the surveys that we can drill down to, but we could also have the version of this that someone is there at one of those testing facilities that has been stood up for the emergency basis. So in this case, they're on their phone, maybe on a tablet, and they're capturing this information as the person's driving up. They're asking these questions very quickly, marking what the answers are, and being able to submit that. And then even to the point of being able to try and see with the Power BI, seeing the testing facilities and making recommendations for them. Obviously, if they're there at the testing facility, some of this stuff may not be, may not be important, but they may want to make a recommendation of, for a next step, you may want to call your PCP, or wait 3 days, we'll have an answer for you. We will be contacting you with the results of this. And finally, that email. So couple of different ways and platforms that we can give people access to this, and obviously a lot more that we can make extensible through this, depending upon the individual state or local government's needs and their specific questions, whatever information they're trying to gather. But I think the ease of being able to stand this up from the outside portal aspect to the internal data gathering, and then being able to have the ability to slice and dice that data through through the Power BI infrastructure is going to make this really helpful for organizations.